Let's discuss about image forming by plus lenses. Why I choose this topic is because of clinical correlations that we are going to make, and a lot of times student cannot make the clinical correlation between plus lens, how image forms, and exactly with the other clinical procedures. For example, 20 diopter examinations of fundus, 70 diopter, 90 diopter, or let's take example of stand magnifier. Okay, so let's try to understand how image is formed when object is placed in a different place in visual axis. So in this presentation, a lot of pictures and the text taken from this reference book. Okay, it is Stephen H. Schwartz in 2019 edition, I think third edition. And this is the chart I have taken from the Schwartz. But at the same time, I want to talk about very briefly about minus lens. So in minus lens, no matter what, where is object is at any place, doesn't matter. Image will be virtual, erect, and definitely minified. So if object is at infinity, then image will be at secondary focal point. And as we know, in minus lens, secondary focal point is here in this location, and plus lens of secondary focal point is here. In minus lens, his primary focal point f, and his secondary focal point, yes, 2f dash, and somewhere here 2f. So this is the nature of minus lens, which we know. So if we put object at infinity, then image will be on the secondary focal point. Definitely it's virtual and erect, but at the same time image will always be minified, and no matter what you move object towards the lens, image will be minified, and image will be closer to the lens but not exactly touches the lens, but it will move a little bit closer towards the lens. So image will move a little bit closer towards the lens. What do I mean by that is, let's do this, let's understand. If I put object at infinity, image in minus lens will be at secondary focal point, yes. But if I move object from infinity towards closer to the lens, concave lens, the image will definitely move towards the convex lens. That's it. So it's very simple, nothing complicated. So in case of minus lens, we are very sure image will be virtual, erect, and minified. So minification depends upon object location, but it will definitely be minified. Okay, that's it. So let's move to plus lens. Now when we move towards plus lens, everything is complicated there. So at the same thing happens in plus mirror, isn't it? Concave mirror. So concave mirror, so convex mirror and concave lens will definitely create minus, definitely create not minus but minified image. But at the same time, plus lens and concave mirror will create a different type of image. In case of plus lens, we can have real image, at the same time virtual image, and it's depend upon the position of object regarding, with regard to 2f, f. In plus lens, we know these are f dash and 2f dash because it's image space, right? It's image space, and here object space. So plus lens is simple as far. But what we want to discuss is when we put object at particular location with relation to f and 2f, definitely the image behave differently. So that's very important when we are talking about clinical scenarios. Okay, so let's move further with simple diagrams. So I have taken this diagram from, again, from Schwartz book. See, in this diagram, it's defined what secondary focal point. Whenever object is at infinity, because parallel light is coming, again same object is in infinity. This is plus lens, and the blue is minus lens. So where is the focus? Focus is here. So what we learn from it is when we put object at infinity, image will be at focal length. It definitely focal point, it's secondary focal point, not primary. See, in plus lens, here's the primary focal length. This is my secondary because it's f dash, and in minus lens, here's the primary f. and here's the secondary f dash. That's why in minus lens it's virtual, because we create from the just extension of actual ray, but in plus lens actual ray created the image, so it's real image. Yes, so when we put object at infinity, at least forgot optical infinity, but at that particular point image will be at focus. Now what happened if object moves slowly towards the lens? That's the game. Okay, let's move further, and it's the definition of primary focal point. See, primary focal point definition is, if we put object as primary focal point, what happens? Definitely, if we can reverse it, so if we can put object on the primary focal point, the image will be at infinity, isn't it? So that's very simple. It's definition of primary focal point. Now what happened if we put object at a finite distance? So that's very important. When we put object at finite distance in plus lens, at that particular point, see, when we put object at infinity, image will be at the focal length, yes, secondary focal length. But when we put object at finite distance, now image moves away from focal length. See, image will move away. Okay, that's very important. Image will move little bit away if we keep approaching object towards the lens. That's very important point you have to understand. And second point that you have to understand, when we put this is 2f, definitely when we put object at 2f, image will be at 2f, and image will be equal size, which means magnification is unity. That's it, magnification is equal to object, which is m equals to 1, isn't it? So sometimes we can minus 1 because image is inverted, we can tell that. But at the same time you have to understand why 2f is important, because before 2f, wherever the object is before 2f, image will be inverted, real and minified. At 2f, nothing changes. It is real, it is inverted, but magnification unity. So object size and image size is equal. After 2f, game always change. After 2f, whenever we put object after 2f, no matter what, between 2f and f, or at f, or between f to lens vertex, whatever, image will always be magnified. Image will always magnified no matter what in plus lens. Yes, definitely image will convert from real to virtual, that's another point. But no matter what, after 2f, closer to lens, when we put object here, image will be magnified. So what's 2f signifies in optical system of plus lens is 2f is the point from where game changes. Which kind of game? Image will be larger. Okay, that's very important game. And same thing happens again and again. So when we move from this 2f, this dash point is 2f, so when we move from 2f to object is in between 2f to f, it will be real, it will be virtual, but at the same time now image will always be magnified. So what happened at f, or from f to lens vertex, image will be magnified, that's clear, but now image will be virtual, image will be erect. Here's the clinical correlation. When we talk about stand magnifier, we want our object, actually this is, let's take an example, this is book, and this lens is stand magnifier plus lens. We want our object, that book, is within the focal length. Why? Because we want magnified image for our patient. At the same time we want erect image for the patient. Yes, So that's the case. So that's why in stand magnifier, the height of the stand magnifier must be smaller than focal length of that magnifier. Okay, that's the clinical correlation of a stand magnifier. This is the picture for a stand magnifier. That's why in case of a stand magnifier, whenever rays emerge from the stand magnifier, it will be diverged towards the patient eye, and that's why patient either need, if he's or she's presbyopic, they need add, or he's young enough, then he must accommodate, because object lies within the focal length. That's why image is erect, at the same time virtual, at the same time magnified, which we want. But the consequences of that is light ray emerging from, coming out from stand magnifier, is diverse light. So that's why for that diverse light, whether patients need add, or if he is capable enough, then he must accommodate. So that's the consequences of stand magnifier. So a lot of time there is question in university examination and a lot of other entrance examination, why stand magnifier needs accommodation or add. At that particular point, this can be answered on the basis of optics, on the basis of optics of plus lens, which is very simple. But that's, and isn't it the basis of dome magnifier, or maybe flat magnifier, bar magnifier? All this magnifier works on this base, on the basis that object lies within the focal length, not outside of the focal length. If object lies outside of the focal length, then what happened? Image will be inverted and real, and no one wants inverted and real image, because patient want to read those images. So in low vision, whenever we are talking about stand magnifier, bar magnifier, anything, you must understand object should be within the focal length, so that object, image of that particular object, let's take example book, will be magnified, virtual, and erect. Okay, and the consequences, we have to have add or accommodation. So that's the story. Okay, that's the basis of stand magnifier. And in case of uh, for example, in case of minus lens, what happened? In every scenario of minus lens, there is minification. So all this point is taken care in this particular scenario. Yes, this chart, see, that's what I'm talking about. Let's summarize once again, which is very important to summarize. If we put infinity object, image will be at focal point, at this point. Okay, now slowly move object towards 2f, image will move, because it's virtual, image will move slowly towards the 2f. When object is at 2f, image will be at 2f, equal size, inverted, and real. When we move object from 2f to f, nothing happens, only one thing changes, that image size will be larger, isn't it? Image size will be larger. And when we just keep focal length, what happens? Now one thing significantly changes, that image will be virtual and erect. And whenever we are at f2, a vertex of the lens, the same thing, image is erect and definitely magnified. That's important point. So I want you to look this scenario as a story, that some object is at infinity, what happens to the image? When we move towards the 2f, in this game, 2f signifies what? It signifies magnification. 2f, where magnification is unity. Before 2f, there is always magnification, and after 2f, there is always magnification. And what happens? What happens at f? Before f, image is always real and inverted. After f, image is always virtual and erect. That's the game. Okay, just understand. Try to understand this. And how can we correlate with 20 diopter, 90 diopter, 70 diopter in our clinical practice? See, in our clinical practice, whenever we see patient in 20 diopter, so this is the patient's head, where I suppose I examine the right eye. So this is 9 o'clock, 12 o'clock, 3 o'clock, and 6 o'clock. But when we view with this 20 diopter, for example 20 diopter, whatever fundus we are viewing will be inverted. Yes, exactly inverted. So 9 o'clock is here for fundus, 3 o'clock is here, exactly opposite. Vertically also inverted, 6 o'clock is here, 12 o'clock is here. So that's why we rotate our OPD file before drawing, isn't it? So why this happened? Because object lies outside of focal length. So outside of focal length of 20 diopter. But we can tell that. But at the same time, 20 diopter, 90 diopter, and 70 diopter doesn't work in that simple fashion. They work like something like that. See, this is the object. Suppose this is the fundus. Yes, here's the fundus, and here's the lens. So this is plus 20 diopter, and this is plus 60 diopter because I is 60 diopter. So 2 plus act as a plus plus lens, and now plus plus lens, 2 plus plus lens. What happened? Isn't it something like telescope, Kepler telescope? The image of the Kepler telescope will be real and inverted, isn't it? So sometimes we can think like this too. It's very important that how you think. Oh, sorry. Okay, sometimes it's very important how you think. Okay, but we can think in both ways. Okay, what? So that's the case. So that's what I'm talking. It's we see fundus like this. It's actually like this. We have to invert it. So the picture of this, can you correlate with this? It's actually inverted, right? So that's the game. That's what I'm talking about. That's why I'm talking about from last 17 minutes. You have to understand how image changes when object location changes with regards to 2F and EF, and that's very important uh, point to understand. Okay, so I think this is my reference and pictures from taken from other references too that I have mentioned on the slides. So I hope it will help you. Okay, thank you. See you on the next video.